Hello, my name is Frank Schneider. I'm the CEO of Gateway Rehabilitation Hospital here in Florence, Kentucky. And I wanted to talk a little bit about some common myths that exist about inpatient rehabilitation hospitals. One of those is that we're like a nursing home. And that is just, again, nursing homes, skilled nursing facilities are an essential part of the healthcare continuum, but it's just not what we do here as a rehab hospital. Here at Gateway, we see an acuity of patient that is similar to most step-down units in hospitals. We see patients from academic medical centers. We see patients right out of ICUs. And our focus with those patient populations is to really transition them to home. Upwards of 75% of our patients leave our facilities and go onward to home environments, and that usually happens within about 2 weeks. One of the other myths that we commonly hear as a rehab hospital is that you need to have a 3-day stay in a hospital to come to our organization. And again, that is a myth as well. Those elements are really tied into skilled nursing facilities. And we are an acute hospital, just as any other acute hospital that exists. One difference is that we're a specialty hospital, so we do see patients coming to us by referral out of larger systems, larger hospital organizations. And we take very specific care with those patients around some of our accredited programs. We're accredited by this CARF and Joint Commission, and we see patients for general rehab needs for adults, amputation, stroke, and brain injury. So we really focus on those patients that have had some very significant and catastrophic issues occur, and we work with those patients to align them to goals and help them transition back to their lives and the next steps in healing and recovery for their conditions. Also, we do see patients that have had and suffered from COVID. COVID is now a public health crisis, and we do see patients that have had that complex illness, and they come to us for recovery. We do not have active COVID patients in our facility, but we do see patients that have gone through that journey, that have had a long journey in dealing with that illness and fighting that disease. And we are part of the recovery of that patient to gain back function so that they can transition home and resume their lifestyles. Again, please, with COVID continuing in the U.S., please continue to use judgment on your masking and hand sanitizing and social distancing. We do need to continue to work to lessen the impact that this illness is having across our country. Thank you for your time.